All right, we're going to talk about some kidney conditions. All right, so first question I'd ask you, what's part of your renal corpuscle? You should always be able to tell me afferent arteriole, glomerulus, efferent arteriole, and your Bowman's capsule. All right, so when you talk about your kidney conditions, the first condition I'm going to talk about is called glomerular nephritis. We know that this is the nephron. We have our proximal convoluted tubule, which is going to be important. Descending limb of the loop of Henle. We have our ascending limb of the loop of Henle. And our distal convoluted tubule. So the whole goal of the nephron is to get rid of waste. So the first condition that I want to talk about is called glomerulonephritis. So it involves the glomerulus. Glomerular nephritis. So we are looking at the nephron. This whole thing's the nephron. We've got the renal corpuscle and the tubules. So when you say glomerular nephritis, basically you have damage, destruction, or inflammation of the glomerulus. Now, if you have damage of the glomerulus, basically you're going to have a lot of blood spilling out. So literally, you have blood spilling out into your capsule, as well as your plasma proteins, albumin, and basically you're going to have a lot of GFR, and you're not going to really have a lot of things. So your glomerulus becomes excessively leaky, and in its excessive leakiness, it's going to lose blood, it's going to lose your plasma proteins, albumin, so it's excessively leaky. And because it's excessively leaky, you're going to have increased blood cells and protein that's going to be found in your urine. Remember, you should never find blood, glucose, or protein in your urine. The protein is going to be albumin that's leaking out. Now, if this goes on for a long amount of times, you're going to have toxins that are going to accumulate in your blood. So, not only are you going to have toxins, you're going to have electrolyte imbalance with sodium and potassium, but you're also going to have an acid-base imbalance. Now, if this goes on for a very long time, basically you can end up with renal failure. So, long-term glomerular nephritis may lead to renal failure. So, glomerular nephritis is your first condition. Now, renal failure. Basically, when you get renal failure, you increase your GFR. Let's say it decreases by 50%. When it decreases by 50%, what you end up with is uremia. Uremia, anytime you hear something that has emia, like anemia or leukemia, basically think of it as your urine is not able to exit because you have renal failure, kidney failure. You're getting urine basically in your blood. So your GFR is below 50%. In uremia, you have a buildup of toxins in the blood. That's going to include too many electrolytes, and acid-base imbalance. But all of these are just kind of floating in the blood. Now, when you get to renal failure and you have this uremia, basically, if it's not treated, it's going to result in going into a coma, having seizures because you have all these electrolyte imbalance, and if not treated, death. That's renal failure. You get a buildup of these waste that the kidneys would normally get rid of, and it starts to accumulate in the blood, so we call it uremia. Now, as far as acute renal failure and chronic renal failure goes, acute renal failure can be fixed. That's when you have a decreased GFR. But if your renal failure lasts for after 3 months, that's called chronic renal failure. It's 3 months of decreased GFR. Now, the way that you have to live with renal failure, again, that's kidney failure, is your treatment is dialysis. Now, there is 2 different types of dialysis. When we talk about dialysis, dialysis is a way to clean your blood. And there is something called hemodialysis, which is more common. And then there is peritoneal dialysis, which is not as common. You can look through both of those, but when we talk about hemodialysis, hemodialysis is the most common cause. The most common treatment. So dialysis is going to treat only uremia. Basically, it's a way to filter your blood. So the most common is called hemodialysis. Hemodialysis is basically where they temporarily remove your blood. So they literally are going to stick a needle in, I think they're called stents. They usually have to surgically implant a place for you to have hemodialysis. They temporarily remove the blood. The blood then has to pass through a filter, which is the dialysis machine. And the dialysis machine, which is the filter, is going to remove waste, any excess fluid. So they have to weigh them and see what they weigh coming in. But it also has to restore their electrolyte balance. So it's got to get the appropriate amount of sodium and potassium. And it's also going to have to restore the acid-base balance so that they don't have a coma or seizure. So hemodialysis is more common than peritoneal dialysis. Peritoneal dialysis is where they actually place fluid in your abdominal cavity and the peritoneal cavity, and they're going to circulate fluid in there that kind of picks up all the waste, and then they pull it out. So that is called peritoneal dialysis. So hemodialysis is going to be more common. So we have glomerulonephritis, which is basically destruction of the glomerulus, which can lead to renal failure, which we covered. So the next thing that I want to cover is basically going to be glycosuria. Now, we know that the proximal convoluted tubule's job is to reabsorb glucose. Now, this isn't really going to be like a big condition, but it's something to pay attention to because there's 3 things that you should never have in your urine. You should never have protein because that means that albumin's leaking. You should never have blood cells because that means your glomerulus is going on. But you should never have glucose in your urine because 100% of your glucose is reabsorbed at your proximal convoluted tubule. So the condition that you're going to see is called glucose or glycosuria. Now, this is going to be common in diabetics. So when your blood glucose gets way too high, we basically say it's at threshold, your proximal convoluted tubule cannot absorb all of the glucose. So some of it gets leaked into the filtrate because your levels are very, very, very high. Now, the bad thing about this is water always follows the party. So when we said renal failure, that's number 2, and now we're on number 3. So water, unfortunately, is always going to follow salt and sugar. So if we lose glucose and your proximal convoluted tubule cannot absorb all glucose, you have increased glucose in your urine. That's where we get the word glycosuria. Urea means it's in the urine, so glucose is in the urine. Well, you have increased water that's going to follow your glucose, and when you say glucosuria, this is going to cause something called osmotic diuresis. The glucose is causing you to pee an excessive amount. So that's why it's very common for diabetic people to urinate a lot. Osmotic diuresis. Glucose in urine makes you pee excessively, which is technically called poly, which means mini urea. Well, the reason why diabetics pee so much is osmotic diuresis. Glucose in the urine makes you pee excessively. I should write that, pee excessively, polyuria. So those are the 3 conditions that I want y'all to know.